Hello, everybody. This is Gary. Today is Thursday, December 5th, 2023. It is 10:28 a.m. Eastern Standard Time in the United States in Rochester, New York. And this is my Coping with Schizophrenia blog entry for today. Today, my anxiety levels are very high. My paranoia and my delusions are very strong today. I'm finding it impossible to go outside today to go for a walk and do my physical therapy exercises. I think people are plotting against me, spying on me, laughing at me, following me. My auditory hallucinations are pretty intense today. They're telling me the same thing, that people are following me and spying on me. I don't know if I'll be able to go outside today. It depends on how I feel. I'm trying to stick to my daily schedule, including by making this video. But my anxiety levels are very high. My paranoia levels are very high. I'm very nervous. I'm very sweaty, and it's not that warm in my apartment. So I'm really kind of very, very agitated. I do have an appointment with my psychiatrist tomorrow, and of course I will keep that appointment whether my paranoia and anxiety are intense or not. It's important for me to keep my psychiatric appointments and my therapy appointments and medical appointments and appointments with my peer support specialist, who I have an appointment with, I believe, next week. And then I have an appointment with my therapist the week after that. I'm seeing my therapist once every 2 weeks because winter is a more difficult time for people, often with mental illness. It certainly is for me. My paranoia tends to increase. My motivation tends to go down. My delusions tend to get more intense. My auditory hallucinations become more intense and louder. I actually hear the voices as if I would hear somebody speaking to me from outside my own head. They're not command hallucinations. They're not telling me to do anything. But my point is, winter makes this all very more difficult. It also makes my physical pain more intense. I have arthritis in my lower back. I have arthritis in my upper back. I had surgery on my knee on May 13th earlier last year, and my knee still hurts, and the pain tends to get worse as the weather gets colder. So there's a lot going on right now. I feel very agitated, very nervous, very paranoid. Auditory hallucinations are intense. Anxiety levels are very, very high. I'm not suicidal. I'm not violent. I'm not going to go to the psychiatric emergency room. That's totally unnecessary at this point. I'm just trying to make it through each and every day. Winter is always a difficult time for me. It's a difficult time for a lot of people with schizoaffective disorder or anti-mental disorder at all. I suppose there are some people who do better in winter than in spring. I'm certainly not one of those people. We haven't really had much snow or anything like that in Rochester. Today it's kind of cold and rainy outside. As far as I can tell by looking out my window, there's no snowing going on. But my negative symptoms are really intense today. Negative symptoms are symptoms that take away from the personality. In my case, motivation, ambition, excitement to do things, interest in doing things, like hobbies, work, or whatever else it might be. A lack of interest, a lack of motivation, a lack of purpose. And those negative symptoms are very intense today. I have to force myself to get things done. And it's usually very, very uncomfortable when I'm this agitated, and I still have to keep up my daily schedule. So I will do some meditation in about a half an hour. I will take my mid-morning meds, including the Klonopin, and do some meditation and try to calm down. That usually does work for me. But there's nothing else to report on. Physically, I'm okay. I mean, there's nothing wrong. I just feel very, very agitated. And that's pretty much all I have to say for today. Like, comment, share, subscribe.